You know, you can't reduce it to a soundbite. You can't reduce it to, unfortunately, this is complicated stuff. And it is an area where people get terribly afraid. I mean, and you know, and I've been around politics a long time, but the hypocrisy in this debate has been one that has even stunned me. I mean, you know, let me give you 4 quick examples, and I know you got to take this back, and I got to get on the road. I got to read aloud, but you know, we're the only industrial country in the world that has not had both a political, religious, and moral discussion about end-of-life issues. And I'm living through this right now. I'm on with advanced Alzheimer's, and every family this touches on. And you know, the notion that we don't even have a healthcare system that really respects people's and families' own decisions about this issue, and the fact that when it was raised, and this was an issue that was mostly raised, the leaders on the issue around end of life have traditionally been Republican legislators. And when that issue was raised, suddenly it was transformed into death panels. Another example, a kind of hypocrisy in this. To the chagrin of some of you, and but you probably didn't know this, but this is political, you know, Harry Carey or whatever. You know, I, unlike most Democrats, absolutely believe, Chap, that you know, if you're going to have healthcare debate, you got to have tort reform and medical malpractice reform. It's not a silver bullet. You know, we've already got caps in Virginia, but it ought to be part of the mix. So when the amendment came up on the healthcare debate, then this is one of our friends on the other side, one of their top 2 talking points. You know, if we can just get tort reform in or medical malpractice reform, healthcare solution is going to be solved. I was one of 4 Democrats who voted for it. 12 out of the 40 Republicans voted against it. The Republicans, and to the chagrin of Lowell and some in the room, I was very unsure about the public option approach, because I didn't think a further expansion of a major new federal program that might have, and I know, Teddy, you're going to be mad at me, that might have an out-year obligation that we might have to bail out at some point. I was concerned about that from a fiscal standpoint. A lot of us on both sides were. We raised that. That was taken out of the bill on the Senate side. A lot of folks said at the same time, we've got to make sure this whole approach is deficit neutral and actually can start going to slow our healthcare cost. Well, I don't like necessarily the Congressional Budget Office as the scorekeeper, but you can't kick out the referee in the end of the 4th quarter. Because that referee, by the way, does not give any of these bills any credit in terms of savings for where most savings that have occurred in the healthcare field in the last 10 years have taken place, which is in wellness and prevention. You go to any kind of major business, self-employer, that has been able to actually drive down their healthcare costs, and most of those healthcare costs have been driven down by making their workforce healthier, by actually having their employees invested in things like physical education and lifestyle changes. We get no credit for that in the bill, and there's more wellness and prevention in these bills than in anything out there. But even without that criteria, these bills have been viewed as cutting the deficit by $130 billion in the first 10 years and $700 billion to $1 trillion in the second 10 years. And yet, that is kind of dismissed as, well, nobody believes it. Well, if we're going to discount the referee, then how is any of this credible? If we can't drive down our healthcare costs, the 2 things that this bill does is, one is debt coverage. Now, people can argue, well, why are we covering so many folks? There's moral reasons for it, but there's also cost reasons. We pay for the uninsured right now. Every one of us who's got healthcare insurance, we pay an additional $1,000 a year for folks to show up on Innova's emergency room door that are non-compensated. So you've got to get rid of that cost shift. You need to do this not just for moral reasons, but just because the current payment system is so screwed up. The area where we could have been more aggressive, and I got a whole slide portfolio. I'll come back to y'all and give you like a 40-minute presentation. I know that you got your eyes going, oh my God, this is not as easy as no car tax. But it isn't. But it's also been 70 years, Democrats and Republicans alike have tried to do this, and we've not been able to do it. And it comes down to why, on cost containment, we've got to get away from our current financing system in healthcare, which is insane. There is no price transparency, there is no good data, and we basically reward volume instead of outcome. No business would operate that way. And we shouldn't argue that this is a total impossibility. Other countries around the world have been able to do healthcare at a cheaper price and on any kind of, again, what gets measured, gets improved and gets done on any other kind of valid outcome, has been able to do it with at least equal to ours or slightly better healthcare outcomes. Now, again, in our country, if you have a major catastrophic event take place to you, and you have some rare disease, there is no place in the world better than America. But if you have diabetes, if you have hypertension, if you have kind of chronic diseases, this is not the place you want to get those. And that's where 70% of our costs come from. So, you know, this is far from perfect. I would have loved to have been the guy in charge of writing this bill. I think we could have, you know, most of us would have loved to have been part of it. But the status quo would be a financial disaster, a competitive disaster. We have so kind of misinformed, particularly for those of you who are small businesses in this room. If you are a small business in this room and you provide health care for your employees, you are getting totally screwed. That is a Washington political term, not a technical term. Because you're the only people in America that are paying retail. Now, through some of these things, like through these health insurance exchanges, through some of the tax subsidies for small business, you know, if you are not a winner out of this bill, then we have totally messed up. If we can't bring purchasing power to individual market and small business market, which some of these things, again, we have not explained it very well. It is extraordinarily complex. I would welcome somebody able to explain it better. But you know what we've tried to, I think the way this whole piece of legislation started, and I don't think it was you know, anybody's fault, but it was kind of portrayed as that this was an effort around social justice, when I think this should have been viewed more as a thing that we have a current system that is financially killing this country, and unless we can fix that, a decade from now, America's not going to be able to compete, and our deficits are going to explode. And you know, this is just a hole we can't dig ourselves out of. And it should have been much more, the whole debate should have been much more focused on how do we make sure that we actually work on our federal deficit, that we make Medicare stable for the long term, and that we end up lowering our healthcare costs so American business can be more competitive, as opposed to making this simply a social justice argument. And I think that's where it got off on the wrong foot. And you know, this bill doesn't do as much on cost containment as I'd like. It starts things, but I'd much rather have a much bigger hammer. I, for one, for example, would have gone ahead and removed the tax exemption amongst high-cost insurance plans. I mean, I would have been much more aggressive about cost containment in this. And you know what I would simply ask folks in this room who care about this issue is, you know, stick with us, because you know, as much as those of us in Congress perhaps would like to say, can we not talk about healthcare anymore? If this passes, the president signs it, we will be back next year again with something trying to fix it. But we've got to start changing the momentum, because the other alternative was, when it was punted on in the 90s, it took us a decade more, and all the predictions of healthcare cost increases took place. No American business, particularly if you're a small business. You know, I had people finally who came to me, and I will leave. But yeah,
you gotta leave the mic though.
I know. You know, I've been kind of down for a week. You can, you know, I'm back out on the road, and I can't get the mic out of your hand. But you know, I'll close with this story. You know, I, like you, Chap, I'm very proud of the fact of the bipartisan support I've gotten, and a number of, you know, particularly very conservative business folks. And you know, I had somebody say to me, Mark, you know, this healthcare bill, oh God, how awful it is, how it stinks. And this is a very conservative guy. About 3.5 weeks ago, he said, well, Warner, I just got a 28% increase in my health insurance premiums. Could you tell me about that healthcare bill one more time? You know, the status quo will kill us. So let's shake up, give the a jolt to the system, and then we're going to need all of you involved. And to your